So the very next question you should ask yourself is, do I have metabolic syndrome? And what is metabolic syndrome? You can have metabolic syndrome at any weight, but it's much more likely that you have metabolic syndrome if you're overweight. But I've got news for you. Almost every American begins developing metabolic syndrome in our teenage years. And this is due to the standard American diet. Nutrition scientists call that the SAD diet for short. In nutrition studies, lab animals that get placed on the SAD diet universally develop worse health and die sooner than the other animals. Okay, so first of all, what is metabolism? Metabolism refers to the way that your body uses energy. You eat energy, all the food that you eat contains energy, and then your body uses that energy to do all of the things that it needs to do, to get you from here to there, to wake you up in the morning, to build and repair every part of your body. Every part of your body is being replaced every hour of the day with the energy that you eat. So the energy you eat keeps you alive. It keeps your heart beating. It keeps your lungs breathing. It keeps your liver and kidneys functioning to get rid of the toxins that you eat and drink. It keeps your immune system working hard in your defense against bacteria and viruses and fungus and parasites and even cancer. And the energy coming in doesn't just keep you alive, it actually determines how well you are functioning throughout the day. That means your level of energy determines your mood, your ability to think, your ability to communicate with others, and even how well you're able to speak. Think of your metabolism like the energy coming into your home. If the lights are dimming, then nothing is running right on the inside. So if you have a healthy metabolism, that means that the energy that you eat goes to fully fueling your body. So your body can be fully on, fully able, and fully protected. Don't forget, your immune system needs energy too. So what is metabolic syndrome? Metabolic syndrome means there's a disconnect between the energy coming in and how your body uses it. And most often, this develops because of a problem with insulin. Insulin is the hormone that helps your body use the energy that comes in. And if the energy doesn't get used, it gets stored. This is exactly why people that have problems with insulin store too much energy. In other words, they're overweight. And if all of the energy you eat is going straight to storage, then none of it is going to power your body and your brain. This means you will look and feel energyless. It took doctors years to define metabolic syndrome and many more years to actually develop markers for the syndrome. That's because at the beginning of metabolic syndrome, your symptoms can be so vague, they're actually difficult to put your finger on. And most of those vague symptoms are so normal that we think of them as a normal part of life. So if you compare this again to energy coming into your house, it may look like the lights are a little bit dim, and maybe only you recognize it at that point. So what does this look like exactly? These are the patients that are usually complaining that they just don't feel right. They feel exhausted all the time. They feel like they don't have enough energy to get through their day. They may be having trouble with thinking, trouble with paying attention, trouble with keeping up with their kids. It can be pretty upsetting, but when these people go to the doctor, most often they walk away disappointed because most every test we can run at this point is usually normal. And yet they know something is wrong. They insist that something is wrong. And so often these people walk away with a diagnosis that they don't deserve. Some of these vague diagnoses include depression, fibromyalgia, chronic fatigue syndrome. Some of these people even get diagnosed with hypothyroidism when their numbers are normal. And many of these people get placed on medications that they don't need. I can't really blame the doctors or the patients at this point because these symptoms are really difficult, like I said. Often patients go in searching for a diagnosis and hoping for a prescription that's going to resolve it. And that's not the case with metabolic syndrome. We doctors are not taught a whole lot about metabolic syndrome because the cure is simple. It doesn't include a medication. It only necessitates that you learn how to eat right. Because we were having difficulty identifying metabolic syndrome, we did come up with some criteria to actually define the disease. So there are 5 criteria for you to actually be diagnosed with metabolic syndrome. Those are high blood sugar, high blood pressure, an expanding waistline, and a cholesterol that is off in 2 ways. You have to have high triglycerides, a bad form of cholesterol, and low HDL, or good cholesterol. If you have all 5 of these, congratulations, you have clinched the diagnosis of metabolic syndrome. But you should know, if you have just one of these, you're on the path to developing all of them. And if your doctor waited for you to develop all 5 of these before they diagnosed you with metabolic syndrome, shame on them, because there are hundreds of other signs that typically develop before these. I'm going to read from a list, okay? And I want you to know that each one of these things doesn't necessarily mean that you have metabolic syndrome, but you start adding up all these things, and when I talk to somebody, if they're starting to name a lot of these things, or I'm seeing a lot of these things, my spidey senses start to go up. So here we go, starting at a young age. Poor grades. Yes, that lack of energy and inability to think well and pay attention will lead to poor grades. And this can sometimes go hand in hand with behavioral problems. Many of these kids get inappropriately diagnosed with ADHD and put on medication. These same kids may have a lot of cavities or inflamed gums, gingivitis. Poor dental health at any age is an indicator of metabolic disease. Problems with your hair, skin, and nails are another sign. If you have brittle, dull hair or ridges along your nails, if you suffer from terrible acne, eczema, psoriasis, or rosacea, you may have metabolic syndrome. Again, taken individually, these can be caused by a lot of things, but when you start adding them all up and they're all occurring in one person, it's pointing more and more to metabolic syndrome. Okay, so what else? Headaches, especially migraine sufferers, indigestion, reflux, irritable bowel, poorly healing wounds. Do you just get sick often? In the elderly, this just might look like cognitive decline or early dementia. This leads to hormonal imbalance. For women, this can mean very heavy periods or no period at all. Infertility, especially when associated with PCOS, is a sure sign of metabolic syndrome. Did I mention arthritis? Chronic pain, chronic neck and back pain, pain in your joints, these can all be caused by the inflammation of metabolic disease. Fatty liver disease. Your liver is one of the first organs to try to protect you from all that extra fat storage. Okay, I'm jumping all over the place, and I know this can sound like this is ridiculous, like I'm just naming all the things. But these are the things that happen when your body is not running fully powered. Your whole body is just getting by, and many of your organ systems are suffering. These are the risk factors that should indicate you're headed towards a full power outage. And what does that look like? That looks like a heart attack, a stroke, diabetes, cancer, Alzheimer's. So these are the worst things we're trying to prevent by improving our metabolism. But even if you have one of these major problems already, we can prevent it from getting worse. And some of these things can be reversed altogether, like heart disease, your cancer recurrence risk, and type 2 diabetes. And if you've got a little fat storage problem going on, that's easily fixable by correcting your metabolism. So at this point, some of you may be thinking, I needed to hear this. Thank you. You may be thinking, I definitely have metabolic syndrome and nobody ever told me that. And others might be thinking, this is crazy. I'm just here for a little weight loss. You might be thinking, I'm not sick, I'm not suffering. In that case, you might get a little bit more than you bargained for. I have about 100% track record of people coming to me in week 2 and saying, I thought you were kidding. I really thought it was impossible that a better diet could do all those things. But holy cow, I feel crazy better. So I look forward to that for you. I look forward to saying, you're welcome.